Okay, sir. So, good morning to all of you. I would like to thank uh, Dr. Pratik Rastogi sir, as well as the team of KMC and respected Dean sir, who has considered me to share the knowledge and know-how of how to approach a biological warfare and bioterrorism. So it is about the myths, the mythology, and the reality in past, present, and future. So myths are related to the false belief, and mythology is what our culture, the cultural stories related to the religion, related to some learning which has been by the message which is given by the Almighty God, or the stories which are formed, which is told by our grandmothers to us, and we read our religious literature. And reality is what we are doing right now, managing patients.
Vivekanshu, we can't hear you right now. Think you got muted. Kindly unmute yourself.
Now, sir, is it
Yeah.
audible?
Yes. Yes.
Okay, sir. So we are trying to make you understand that we are discussing the myths, the mythology, and the reality related to biological warfare and bioterrorism. It is in past, present, and future. That is what has happened, what is currently happening, and what may happen. So that terrorizes us. That is what we say, the biological agents which can terrorize us, which can irritate us, and which can create a panic. So these all things we will try to discuss today and understand how we can better manage these cases by following the international guidelines and our learning from our past. So there are a few definitions which we will discuss: the history of bioterrorism, the bioweapons of mass destruction, and then what to expect in event of bioterrorism threat and what we can do to help. Now, when we come to the first definition, the bioterrorism is the deliberate release of viruses, bacteria, toxins, or other harmful agents from plants, animals to cause illness or death in humans, animals, or plants. Mostly we think that bioterrorism is related to humans, to the human population, but it is also related to the animals, which we keep with ourselves. That is the pet animals, the animals which are kept in the farm, like the cows, the buffalo for milking, and the plants. That is the farming we do. So the farming we do, and we are getting the uh, seeds, the products from the. About the definition, we have discussed first definition, that is the bioterrorism. It is the deliberate release, not the accidental release. Deliberate means the intention is to harm. Intention is to harm the enemy or the uh, enemy belongings. That is the family, the society in which the enemies are living. So that is the deliberate release of biological toxins, which are generated by either the viruses, the bacteria, or the toxins or other harmful agents from plants, animals to cause illness or death in humans, animals, or plants. So these are all related to the broad term what we call the bioterrorism. Now coming to biological warfare. Now when we say warfare, it means the weapons which are involved. So what are the biological weapons? So they are the toxins, the infectious agents which generate the endotoxins or the exotoxins, such as the bacteria, the viruses, or the insects, which are generating the toxins, the venoms, and the fungi, with the intent to kill or incapacitate humans, animals, or plants as an act of war. So it is again not only incapacitating the humans, it can incapacitate the animals or the plants which are in possession or which are in service to the enemy. So if one country is attacking another country and they are incapacitating either the humans, the residing animals, or the farming which is done commercially, and that is getting damaged. So that becomes an act of war, like happened in Vietnam War, in which the farming was getting damaged. So now coming to the weapons of mass destruction. Weapons of mass destruction are the biological warfare in which we discuss about the nuclear, the chemical and the radiological warfare, which are part of a warfare, but they are not in biological term which comes. So when we define biological warfare, it comes in the group of C, B, R, and E. C stands for the chemical, B stands for the biological, R stands for the radiological, N for the nuclear, and E for the explosive, using weapons of mass destruction. So again, it is the weapon is not the single weapon like a sword. It is a weapon of mass destruction which can kill many at the same time. So it is killing many in a group, killing many people in a same time or at a same place within a duration of time which is acute, that is within few hours or within few days people starts dying. So that is the weapon of mass destruction which is used, and if it is used, the biological weapons are used, then it becomes the biological weapons of mass destruction. Now coming to what are the common bioterrorist emergencies which can we can face if we are working in the emergency, and if we are managing, and mostly in the midnight we get the calls or the information as somebody has injured, that is injured in a mass scale, like a bomb blast has happened in the train. So it is a mass terrorist activity. Similarly, bioterrorist activity, it means a gas is released inside a subway. That happened in Tokyo. So a toxic gas was released which was sarin. So it caused the chemical injury to many people at the same time. So it was classified as a bioterrorist activity. Similarly, there can be intoxication, like the methanol Hooch tragedy which can occur, although it is mostly unintentional because it is of we were discussing about the common emergencies related to bioterrorism. So they are the eyes, easy to remember, the mnemonic, the injuries, the intoxication, the ischemia, the illnesses, the infections, the immunological disorders, and the insanity. They all can be created with deliberate action on a mass scale by ill intention to harm many people. And these emergencies we will try to understand with our scientific knowledge as well as with our past history, which is mentioned in our literature. So, what are the biological warfare which are discussed in either in the mythology or the historical wars? So, we have read the Indian mythology. So, I will try to correlate with the Indian mythology, the Dev Danav Amrit Manthan which occurred, that is the churning of halahal, and uh, the Lord Shiv took the halahal which was similar to the copper sulfate. It was blue in color, so that caused the Neelkant. So he took it and kept it in the throat. So it became the Neelkant. So that is related to that he prevented the bioterrorism, the biological warfare between Dev and Danav by drinking the halal, so that it does not damage the society. So that was the first incidence in our mythology related to biological warfare. Then the Ravan Yudh in Ramayana, we will discuss it in detail. Then the Bhagavad Katha, in which there was another story which was related to the biological warfare between Krishna and the Kans, his uncle, maternal uncle. Then coming to the Mahabharata, in which the Kaurav Pandav, the Duryodhan tried to poison Bhim by food laced with aconite meetha vish to kill his war rival. Then coming to the historical wars, they are actual documented because mythology is what we have heard, but actual reality is still needs to be proven according to what we say in the science. We need an evidence for them. Although there is a lot of literature is there, but
Continue. Before
okay,
you start, there is a question. As you have asked our students to ask question, he
yes, sir.
asked, "What is your take on allegation that coronavirus is a bioterrorism agent?" Or
Yes,
you
that is
want to
what we
answer
are.
it in the end?
No, no. In the meantime, we will answer it because it is one of the biological warfare suspected warfare agent which we are suspecting. Till now, it is not clear. So we will discuss it in between. We have one slide dedicated to the coronavirus also because that is the panic which it has created. So we are coming to that. So we will continue with this, and I will
Okay.
answer the question in that. So we were
Okay, fine.
discussing about the mythological war which are related to our Indian culture. Then there are few historical wars. That is the Roman War, the Alexander Porus War, which was also related to India, related to Vishkanya. We will discuss it. Then the scorpion and the snake bombs. We will discuss it in detail. Then the Syria-Palestine war, the Vietnam-US war, then the subway attack we discussed, and the religious cult war that we'll also discuss related to the Osho, Oregon, related to Salmonella. So these are all the biological warfare which has happened either in mythology or in history. It keeps rotating in our mind, and the current coronavirus pandemic, it is also suspected. So when we go by the history, there are incidences which has happened and which is documented. Like in 1500 BC, there was tularemia victims. It was an infectious disease. It was the victims suffering from tularemia were driven into the enemy land, causing the epidemic. Similar allegation was made to corona victims also that they were mobilized from one country to another to create the epidemic. But it was not deliberate, intentional till now. Nobody has intentionally mobilized. It is the people who belong to that place. They are migrating as per the international guidelines by the WHO. Then coming to again to the ancient, that is during the first sacred war in Greece in about 590 BC, in which there was hellebore toxic plant which was uh, uh, used to poison the water supply of the besieged town of Kirha, that is the Delphi, and it is a cardiac glycoside, so that caused cardiac arrest in many, cardiac arrhythmias, and that's how it created a panic in the town, and that was documented. So it is an act of bioterrorism because it was done by the enemies. Then the another was the Roman commander. He poisoned the wells of the besieged enemy cities in 130 BC by copper sulfate, putting it in the wells. Then, then in 184 BC, there was one in which the clay pots filled with venomous snakes were instructed by the sailors to throw them into the deck of enemy ships. So this was an act of bioterrorism using the biological weapon that is the venomous snakes. Then in about 198 AD, the Parthian city of Hatra, that is the Iraq, they used scorpions in the clay pots to throw. That is the scorpion bombs. So they were known to be as snake bombs or the scorpion bombs because the clay pots were filled with those animals, and when they were thrown, they used to break on collision, and the victims used to get the scorpion, live scorpion or the snakes who had been hit, so they immediately bite or sting. That is the snake bites, scorpion stings, and that causes immediate toxicity to them. So that's how it was documented in one of the bioterrorist attack. Then in 1346, there was Mongols who catapulted cadavers of plague victims into the city. So this is again an act. Then coming to the Salem witch trials, which began between February 9, 1692 and May 9, 1693. They were related to the ergot, which was a fungus which grows on the rye grain, and that caused the toxin-induced mania in the victims. And they were suspected to be witch. And the witch trials were done and they were punished for that unnecessarily, although it was unintentional. It happened accidentally. But people suspected that it may have been done as a deliberate act to harm the residents of that city, the Salem. Then in 1710, Russians used plague victims against Swedes. Then in 1767, a French and Indian war, blankets from smallpox hospital provided to Native Americans resulted in an epidemic of smallpox. So that is what the same was suspected with the poisonous robes. So they are containing the toxic organism and they are transmitting it to the another people and they are getting infected with that. Now these are all the incidences which has happened when there was no vaccine for it, there was no therapy for it. So that has caused the major pandemic and that has created a lot of fatalities and suffering and that created the terrorism among the public. Then in World War One, Germany sent infected horses and mules into the Allied lines. So that was again an act. Then in World War Two, the Japanese military unit 731 killed thousands of Chinese in Ping Fan, Manchuria with various agents including anthrax. So anthrax bacilli were utilized. Now, when we say the infection, the infected agents, the toxins which are related to infection, they have a pattern in which if inhalation is done to anthrax bacilli, that it causes rapid pneumonitis and that causes the fatality, not the cutaneous anthrax, which is quite common among the animals. But the inhalation anthrax or inhalation botulism that creates the bioterrorism because that causes major casualties. So that we need to understand. Am I audible?
Yes, you are audible, Vivekanshu. You are
Okay,
audible.
okay, 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 sir. Okay. So now coming to the Osho bioterror attack, it happened in 1984. It was an in the food poisoning of 751 individuals in Oregon through the deliberate contamination of salad bars at 10 local restaurants with salmonella. The target was they had hoped to incapacitate the voting population of the city so that their own candidates would win the 1984 Vasco Country elections. A total of 751 people, including members of the Vasco Country Commission, became ill with nausea, diarrhea, headache, and fever. And 45 people were hospitalized, but no one died. So it was the first and still the largest germ warfare attack in the US history. So in this, Osho was mobilized from that place to India as a sort of punishment because he was a religious guru. So his accomplices were punished because their his followers did the act, not himself. So he was forced to mobilize from Oregon to India. So that was one of the bioterror attack related to Salmonella. Then there United States is running the bioweapons program, although it is in controversy, but there is in 1950 they started biological stimulant sprayed over San Francisco. Then in 1966 biological stimulant sprayed in New York City subway system. Then in 1969 President Nixon suspended the offensive program, and in 1972 US, UK, Soviet Union signed biological weapon convention. But still then, there was a recent incident in April 2013, which is envelopes addressed to President Barack Obama, Mississippi Senator, and the Lee County, Mississippi judge tested positive for rice. So the envelopes containing those white powders that created the terror of bioterrorism, and it was not a fake terror. It was reality because when they tested for the powder, it contained the ricin. Ricin is a biological toxin which can cause sudden deterioration, unconsciousness, and the person can die. So that is a biological toxin in which there is no antidote, and it is a plant product by the castor plant. So there was again that incident happened in 2014, reported in US. So they were punished, the culprit were punished, and it became an event related to bioterrorism. Then in Soviet Union also there was a bioweapon program It was running at massive level when Soviet Union was there. Now it has been split, but there was USSR, which was running the bioweapons program, and many detail known through defection of high-ranking scientists, weaponized numerous biological agents. Much of the offensive research took place after signing biological weapons treaty. After dissolution of Soviet Union, leaks or dissemination of scientists and bioterrorism agents were suspected occurred, and many incidences here and there occurred, but there was not a mass casualty which occurred. Only individual cases which were reported, so connected to the bioterrorism, but it was the biological weapons which were used, but not terrorizing the public in general. It was few spies which were killed by the bioterrorism victim. That we will discuss in detail. So now coming to why the biological agents are favored. Because the biological agents are relatively easy and inexpensive to obtain because they are generated from the environment. They are available in the environment and you just have to identify them by the scientific knowledge and how to use them to harm others, and then you can harm many people. So that is unethical, that is illegal, but people do that, and that is why the biological agents are preferred because they can be easily disseminated. They can cause widespread fear and panic beyond the actual physical damage, and they simulate the natural disease process. So there is no bloodshed most of the times. By biological agents, there is no bloodshed. There is no bleeding. There is no open wounds, just like in explosives. And the persons, the victims, they die gradually within days. And nobody is able to identify, get alarm until unless anyone from the medical background suspects that this is occurring in a group, in a people who have come from the same place, who have been victimized from the same biological weapon. And that's how they are identified as biological agents. Now, why biological weapons? Although challenging to develop, still easier and cheaper to obtain than nuclear weapons. And unethically scientists to earn easy money with expertise defected to raw nations, and their potential to cause destruction and hysteria. So it is not just the actual destruction, even the fear of destruction, even the fear of death creates an hysteria, and that has created panic in the society, in the population, and that has caused major harm to the life, to the property, and to the plants and the animals which are related to the human beings. Now, what are the different bioweapons which we can understand in a flowchart simply? The microbes, that is the smallpox, rabies, polio, the corona, then the bacteria, the plague, the anthrax. So these are all getting communicated through the environment which is favorable. That is, they are transmitted through droplet infection. The polio, the rabies, the smallpox, the corona, they are transmitted through droplet infection. Similarly, the anthrax, the plague, so it is the pneumonic plague, not the bubonic plague. So the pneumonic plague is transmitting by droplet infection. So it is easily transmitted from one victim to another. So once few persons are infected, and if they go into a society, they can infect others, and that can exponentially enlarge the number of the victims. So that is the pandemic situation which occurs by bioterrorism. Then the fungus, the Claviceps purpura, the ergot witch hunt, which has happened in the past, and then the algae, the algal blooms, which occurs in July to September. This is the favorable season for algal blooms, but they are unintentional. But they can be used as a bioweapon to cause food poisoning in many people if they are not aware that this is not the right time to eat the seafood. So it is commonly said that if you want to eat seafood, you should not eat in the months in which there is no R. So when you see January, there is R, February, there is R, March, there is R, April, there is R, but May, June, July, August, there is no R. Then September, October, November, December, there is R is there. So it is safe to eat the seafood. But in the rainy season, in the monsoon season, which starts from May to the August, it the we should avoid eating the seafood because that can have the toxic algae which can cause ciguteria toxicity, tetrodotoxin toxicity, which are neurotoxic, which causes neuroparalysis in the victims because it bioaccumulates from the small fishes to large fishes and to the largest fishes. And the people who are eating the seafood, they get intoxicated, and that can cause the pandemic situation or the endemic situation in that local area when the people are consuming the seafood. Similarly, the plants, that is the flowers. Now, how can the flowers cause bioterrorism? So, the mad honey which is generated by the rhododendron flower, so that has caused the bioterrorism. It was used as a weapon by the Romans to defeat another army. They kept the mad honeycombs on the way for the army to come. The enemy army was coming, and they got the honeycombs. They thought that it is full of honey. We should eat it. It is sweet in taste, and they consumed it, and they all become mad. That is the drug-induced mania. The toxicity which is caused by the mad honey, it causes toxic bees. The bees are the generated by the honeybee, and they causes bradycardia, bronchoria, bronchospasm, and ultimately death of the victims. So that is the three toxic bees which occurs with mad honey toxicity, which has caused bioterrorism. Then the seed extract, the abrin and the ricin. So we have few seeds in which we can show you. These are the abrin seeds. You must have seen the rati seeds, the Abrus precatorius. So these are the red colored seeds. So they are used to prepare the sui that was done in past to kill lot of cattle of the opposite party, the enemy. People used to do that in rural areas, and this was used as the seeds crushed form and then dried in the sun and made into needles. So it is one of the most potent plant toxin, the abrin, which is the most potent plant toxin, and it is just the nanograms, 1 nanogram can kill the victim. Similarly, we have ricin, that is the castor seeds. These are the castor seeds. So they cause similarly the ricin toxicity which can occur, right? So we need to understand that there are few toxic weapons which are generated from the environment, which can be identified by the person who knows about them, and they can utilize it for harming others. Then the berries and the cherries, the dhatura, which is the scopolamine, which is used for creating the zombie, the voodoo magic. We'll discuss in detail. Then the roots, the aconite arrows, which were used as weapons, which were applied. The aconite paste was applied on the arrows to kill another person. So from aconite, the word acon, from this was derived the toxon. So toxon means the arrow. So it was the toxic arrows which were from the aconite that has generated to the word of toxicology. Then the animals. The animals are the vertebrates. They has been in the mythology we see in the snakes in Ramayana and Mahabharata. Then in Ramayana there are monkeys which were utilized. So the monkey king, the Lord Hanuman, he was utilized and his team. So they also became the biological agents because they were not humans and they were trained to fight the Sri Lankan army or the Lankan army, right? So they were utilized as biological weapon to win over. So the monkeys caused fire all over the Lanka. So they were utilized as in mythology. Then the poison dart frog, which is there, which can be used for killing. So poison dart frog is this. You can see there are multiple dots are there. It is fluorescent in color. It can be identified easily. And this is poison dart frog. It is actually used to prepare the arrows for killing people because it paralyzes. It is a neuroparalytic toxin. So this is what again used as a biological weapon. Then the fish, fugu. You're knowing about fugu fish. That is, it contains tetrodotoxin. It is very small. That specimen of it is our collection of specimen from Indian Society of Toxicology. I am just showing the specimen which look alike. They are not the actual ones. They are look alikes. So you can identify this. This is the fugu fish. It is swollen. It is having that the fins, under the fins in the ovaries, there is a tetrodotoxin, which is a neurotoxin, which causes neuroparalysis. So it has been utilized for creating the zombie voodoo magic in the past, and it is a delicacy which is eaten in Japan. And many accidental deaths occur due to consumption of fugu when the proper preparation is not made by removing the part of ovaries which contains the tetrodotoxin. So accidental bioweapon it is, but sometimes it can be utilized for killing people. The extract, because tetrodotoxin is again a potent biotoxin. It is also in very low dose, it can be fatal to the victims. So this is also a bioaccumulative toxin which is accumulates in the large fishes, and that is what it can cause the toxicity. Then the invertebrates, the cantharides. So cantharides are, we know their beetles are there. So these is, you can identify this, the Spanish fly, the green beetle, which is very different from the red beetle. Now you can see the red beetle is quite large. It looks very horrible, but it is non-toxic. But the green beetle, it was used to apply on the clothes of the robes by the kings, and then it was offered to another, the enemy, as an honor, and that it causes extensive burn, local burn, vesications, and the person dies due to sepsis if it is applied on the skin. If it is consumed, it is an aphrodisiac. But it is a myth because it causes priapism. It itself does not cause any stimulation for sexual activity. It is just causing priapism, so it is a myth that it can be used. But for bioweapon, it has been used by famous kings to kill another, especially in India. Aurangzeb, who used this for killing his enemies as poisonous robes. Then the honeybee. Honeybee also is one of the bioweapon. It has been used by enemies, especially children. They use it to, if a person is going near the honeycomb and somebody throws a stone on the honeycomb, then the honeybee suddenly they come in the group and they can bite. So they can also kill you. So these are honeybee you can identify. They have a sting and that can cause anaphylaxis. And if many honeybee bite gives a sting, then it can cause severe toxicity of anaphylactic shock in the victims. So these are the bioweapons in short. Then coming to details, the witch hunt. Now, when we think about the witch hunt, we think it is fungus to the mind of the person who thinks about the witches. Because in today's world, we don't believe in who are the witches. It is just a speculation, but it actually happened when in 1692-93 there was an outbreak of rye infection by ergot, which is an fungus, and more than 200 people were accused. So they were the victims, but they were accused of behaving like a witch. Mostly girls, unmarried girls, young girls. They were accused of trying to become witch because they had the abnormal behavior of mania, psychosis, irrelevant talk that occurred with twitches and spasm. That is the facial twitches which occurs, the spasm. So that created the horror that these persons are enchanted by witches, and they 30 were found guilty by the court, and 19 of whom were executed by hanging. So they were found guilty of being a witch, and which they were hanged by execution of the legal order by the court at that time. So you can understand how much uh, myth was there related to the ergot. You can see the ergot, which is a fungus which comes on the rye. And ergot is a fungus blight that forms hallucinogenic drugs in the rye bread, which is ergotamine. Now, ergotamine is a drug which we advise actually in migraine, but in overdose, it can cause hallucinations. The person can suffer paranoia, twitches, and spasm. So this abnormal behavior of the people who were suffering from the intoxication. They used to dance around abnormally, and that was known as the dance of death because they were punished by hanging. They were not dying of that toxicity, but they were ex- identified as witches and they were punished. So it was known as Saint Vitus dance because the victims they suffered abnormal spasm when they consumed it regularly. The rye infected with ergot. It is not just one ingestion. It is a chronic intake which causes ergotism, and that ergotism is causing the witch hunt which occurred actually, and that was again thought to be an act of terrorism by people residing in another city. They may have infected the rye which was grown in that the farms. So this was a biological weapon which was ergot was used to terrorize others. So when we come to the principle, the basic principle of any illness, we have read this in our first MBBS, the connection in the pathology, the connection between the agent, the host, and the environment. So we know there should be an agent that we have discussed, different agents, and there is a host in which he is ready to host the agent. That is, the agent is actually it is coming as a guest to the host in the favorable environment, like Corona came. Corona illness came in winters when there was favorable environment for its rapid multiplication inside the host, that is the human host, right? But when the guest becomes a pest, because the guest is now utilizing the host for creating more of its RNA and infecting others, and it is causing illness and death in the host. So it has become a pest. So the guest becomes a pest in the illness triad, what we call the virtuous triad. So it can cause the death of people, and this connection needs to be understood when we are thinking of any epidemic related to the environment. So one of the most common was in the past was plague, and that was the rodents. Rodents were the potential couriers for bioterrorism agents. Just like we saw the couriers which is coming in the envelopes, the rice and powder is coming. Similarly, rodents were the carriers, the couriers for bioterrorism agents, that is the plague, the different infectious agents which can be transmitted from one house to another, from the dirt to another place. And this has came out as the recent study in 2013. So we thought, is it related to us, to our mythology? So we thought about Lord Ganesha. Now, why Lord Ganesha has a mouse? Now, Lord Ganesha is known as the conqueror of obstacles, and the mouse is kept as a vehicle, is symbolically shown to have conquered this pest because rat was the major pest during for the farmers because most of the Indian population lives in villages. Still now, 70% of the population lives in villages, and major occupation of Indian population is farming. So if anybody is farming, then the rat become the pest for destroying the farm. So that is, they become the agent for bioterrorism. If they are deliberately put, many times the incidents has been reported that somebody, the enemy person from one farm to another, they are comparing that his growth of the plant is good, the growth of the grains are good. So they used to release the rats in that farm to destroy the cultivation. So that is an act of bioterrorism which can occur. And similarly, the rats can carry the disease of plague, right? So you must have heard a story. It was in uh, past story in our schools we used to read. That was the Pied Piper of Hyman, in which he was a tamer. He was an expert in taking the rats away by playing a flute from the city. So a city was suffering from plague, from the plague of rats who were destroying all the crops, who were infecting, who were transmitting the infection. So the people, they found that this person is an expert and he can take away all the rats by playing the flute. But ultimately, they didn't give him the credit. And then he again applied the same principle by enchanting the children of that city and took all them away down to a valley, and they all died. That is the story of Pied Piper of Hymen. It is related to bioterrorism, which is occurred by the rats, and then our Indian mythological story. Now here you can see the image of Lord Ganesha. You can see a snake around the belly of the Lord Ganesha. Now this is what was the remedy which was provided by the Lord Ganesha, or we can say by the people who suggested it, that you have to release the snakes where there is infestation of rats are there. So the snake charmers came in picture. So this was a profession in the past of snake charmers. You used to keep non-venomous snakes, not the venomous snakes, because the venomous snakes will harm the farmer, his family. So they used to tame the non-venomous snakes, and they were asked to release the non-venomous snake in the crops to kill the rats. So they were kept as the natural pesticide when there were no chemical pesticides. So they are classified as a natural pesticide, the snakes. The snakes are the natural pesticide for killing the pest, that is the rats, and the different insects which harm the grasshoppers. They harm the crops, and the snake became their predators. So they kill them. So this is the defense of bioterrorism, which is given by Lord Ganesha by sending snake as pesticide. So that is how we can correlate with our mythology, that how the rats as an agent of bioterrorism or as a couriers can be controlled in the past. Now we have the artificial pesticides, the rat kill is there, which is a chemical pesticide which can be used to kill, which contains coumarin derivatives, which contains barium, which contains thallium, so that can kill the rats with chemicals. So now we are not depending on the snakes. So now snake charmers are not there, but it in past it was there. So then coming to again our Ramayana, it was the snake attack by the enchanted curse, the Naag-Paash, which was suspected to be an anaconda, boa, or python, non-venomous snake, which enrolled around Lord Ram and Lakshman, constricting force on the chest, caused asphyxia, unable to exhale carbon dioxide and inhale oxygen, causing blue cyanosis due to the CO2 retention. And how they got released? It is by their vehicle of Lord Vishnu, Garud, who is a predator of snakes. So now here the snake has become the biological weapon, which was sent by Ravan or his son Indrajit to kill Ram Lakshman. So they utilized, because the boa, python, anaconda, they are quite common in Sri Lanka. It is a coastal area. So there you can find these. They are there and they can kill people, especially children. Not actual adults, but children can die. And they are still dying, especially the people who keep python as a pet. And if there are small children are there, then in sleep in the night, they can crawl around and they go in the crib of the children and they can crush them by rolling around, and that can cause asphyxia. And that is what we have seen or read in our mythological stories, that they started turning blue. The Ram, Lakshman, they started turning blue. This is what you must have seen the recently during the Corona lockdown. We again saw the Ramayana, and you can correlate that it was the Naag-Paash was actually a non-venomous snake. It was not a venomous snake, because python, anaconda, although they are being terrified that they are very harmful, they can be venomous, but they are mostly non-venomous. So that is a biological weapon. So we saw that in Lord Ganesha story, the snake is used as a defense from the bioterrorism, and here it is used as a biological weapon. So how do we identify the constricting snakes? Simple, few photographs I will share so that you can actually understand that what are boa and pythons. So they are the common name, a variety of non-venomous constricting snakes. They are mammals and birds are their common prey. Hello?
Yes, yes,
Okay, okay, sir.
you're audible.
So we were discussing about the python. So these are the python you can see, the anaconda, then the belly scales. Then this is the anaconda constrictor scene. You can see. Now you can identify this that the scales are not covering entirely in the back, the belly scales. So that is a sign of non-venomous snakes, that they are not covering entirely. So this is the classification you can go through. This is how to identify the venomous and non-venomous snakes, in which the belly scales, the size of the head, and the pit, they all become identification feature for venomous. These are the venomous snakes which we can identify: the krait, then the cobra, then the viper. Then this is the cobra with belly scales. You can see the belly scales are covering the complete horizontally, so that these are venomous. Then the hood of the cobra showing a spectacle mark. Then the mamba, the African cobra. Can you see this? Now this is also related to our mythology. You must have read about Mahabharata. So in this there was Takshak who came to kill all over from seven seas. He came to kill Parikshit, the last king of the Pandav, and then you can see that he was killed by a black mouth cobra. That was the African cobra. That is the mamba. It is the most venomous snake all over the world. So that was at that time that was enchanted to kill, and it has come up in our history. Then the common krait, it is very commonly seen, and we see the common bites that they are neurotoxic. You can identify this. It looks like just like a nylon rope. Then the coral snake, they are red and yellow, kill a fellow. Then these are the camouflaging vipers. Can you see this? The pattern of Chitkabra Samp. They're all vipers are having this pattern. Chitkabra Samp, saw-scaled viper, pit viper. They are having pits. Then there is diamond-backed rattlesnake. It is also a viper. Can you see the Chitkabra? And there is a diamond back on this. You can see the blouse has a diamond back. So it is similarly there is a diamond back on this snake. So it is known as the diamond-backed rattlesnake. It has been used to terrorize, and it makes a rattling sound. You must have heard about the rattling sound. I can just make you listen. The rattling sound is just like this. This is the rattling sound of rattlesnake, which comes when the rattlesnake attacks. So as a batter's weapon, it can be used. It was used once to kill, and that was a demonstration of how the rattlesnake was used for killing. Then the death adder, it adds on. Can you see the design of it? So it is known as the adder. It is another viper which is vasculotoxic. Then the African boomslang snake. It is again bioterrorist weapon can be used for killing people. Then we have already know about the identification of the snakes. Can you see these Chitkabra Samp? They are all mostly the vipers. Then the nylon-like, the krait, nylon-like with the hood. Then that is cobra. And then coming to, we discussed about the serpents. They are prey to hawk and vulture. So they released Ram Lakshman, and then Sanjivani Booti was brought. So that was to rejuvenate the intoxicated Lakshman. It is again, he was in intoxicated state by a venomous organism similar to the snake, and Jadi Booty was used to regenerate. So this is documented in one of the literatures. We found it that Sanjivani Booty actually grows in the northern Himalayas. And this is Selaginella bryopteris. It is Sanjivani. It is a lithophytic plant that is native to Himalayan range, and it is one that infuses life. So it promotes growth and protect against the hard shock and apoptotic activities of ultraviolet and oxidative stress. So it is the Sanjivani Booti which is used as a defense in a bioterrorist attack in Ramayana, the Ram Ravan war in Ramayana. So biological accessories in wars, we have different accessories are there. The cannabis, opium, the cocaine, they're all related to. We can understand the cannabis. Cannabis causes run amok. So it is the mass shooting which occurred in US schools and the Tandav in Shiv Puran. So we can correlate that with cannabis, then the opium, the Golden Crescent, and the Afghanistan War, the Golden Triangle, the British China Opium War, then the analgesic for mines, it was used for the blast limb and for the phantom pain, and the Amul, which was by the Rajput warriors, they were favorite. Opium, which was related as a biological war weapon. So, what are the limitations of biological war weapon? As a military asset, bioterrorism has come important limitation. It is difficult to use as a bioweapon in a way that only affects the enemy and not the friendly forces. So that is what we need to understand when we are discussing about the bioterrorism, that there are limitations of the military assets of bioterrorist weapon when we are using it, that it is difficult to use a bioweapon in a way that it only affects the enemy and not the friendly forces. That is what we were discussing about corona, that it has not only infected China, because we were suspecting China has transmitted it to others, but China also suffered from this. Difficulties in cultivating biological weapons, their ability to procure a virulent strain, the ability to culture large amount of the agent, ability to process agent into a suitable form, and ability to safely handle and store the agent. So they are all the difficulties which are faced by the people who are working on biological weapon research. So then coming to the scorpions, we have already discussed. I will just try to cover it up. The poisonous ropes we were discussing, that was one episode which occurs. It was in 1700. Aurangzeb used this to kill a Rathod prince. This is the cantharidin, which was used as an aphrodisiac, but it was used to apply locally on the rope cloth, and that caused the powerful vesicant effect. Similarly, the Queen of Ganor, she killed the Khan, uh, the king was there by rope in 1723, and then jumped in Narmada River to save her honor. So this was known as Zahirili Khilat, poisonous rope. It is documented in our medical legal books. You can read them. It is very interesting case of poisonous ropes as used as a biological weapon. Then the toxic plants, we were discussing the irritants to the heart, brain, and to the lung. So which plants are toxic? It is the angiosperms, which carries the flowers, and they are the ornamental plants mostly in our houses, and their basic principle of mechanism is irritation. They irritate the heart, lung, brain, the airway, the stomach, the intestines, the different plants which irritate different organs, the vital organs, and that causes the different toxicity, and they can be used as a biological weapon to harm the victims accordingly. So they are the abrus, we have discussed the castor, the calotropis, the abrus suis we were discussing, they can be terror for cattle killing. Then toxic to the heart, the oleander, foxglove, and the cleanthus, they are cardiotoxic. They, even the fumes of them, I can show you the flower. This is the flower of the digitalis. You can see the foxglove. It looks like a bell. It is hanging down, and it can actually cause cardiotoxicity, and the person can go into cardiac arrhythmia. And even the fumes of burning this stem of them, that can cause toxicity. So that can create a bioterrorist attack if somebody burns those the parts of the plants and the fumes are inhaled. That causes the toxicity. Then toxic to the brain, the dhatura, the cannabis, the strychnine. And this is, can you identify this? This is the poppy flower. Very beautiful. And it is looking like papery thin flowers are there. You can see actually in the sunlight, and they can be used for bioterrorism, especially the extract of the poppy. And this is prickly poppy. It is non-toxic at all. It is having a spine, but not having any toxicity. And this is a simple Marquis test which we can do bedside in the crime scene. The purple color indicates. Then coming to the very important poison damsels. This is the last thing I will discuss. It is about the Vish Kanyas. Now, this was famous. We have heard about lot about. It was used by Chanakya along with King Chandragupta to attempt to kill Alexander. But Alexander went away before getting attacked by the poison damsel because there was an epidemic of malaria. So it was not deliberate. The malaria epidemic was not deliberate, although it happened and it prevented the war to carry on forward. And the victims were Alexander's army. So they went away. But it was documented as poison damsel was used. Similarly, poison damsel was used to kill Lord Krishna in our mythological story. It was Putna. So who were poison damsels? If we go for the scientific basis of them, they are the chosen ones who are ultra rapid metabolizer of opium. Now, as poisoner might have multiple duplication of specific cytochrome P450 metabolizing opioids in their body, on its chronic administration, instead of converting the normal 5 to 10% of codeine to morphine, they would convert nearly all into morphine and excrete it all in their body fluids, the saliva, the breast milk, or the urine. So either the kiss or the breast milk of the poison damsel can kill the victim. If the victim is a child, if the victim is vulnerable, and they can die due to the opioid toxicity in sleeping. So this has been documented in a recent article which was on pharmacogenomics and opioid analgesics. So it has been recently correlated with what was in our mythology. So it is reinventing or rediscovering the principle which was used in poison damsel, that was the ultra rapid metabolizer of opioid. That was what the biological weapon was used in warfare to kill by opioid analgesic. So we can understand this. The it, it was reported recently a case of death of a breastfed baby 13 days after birth. His mother was prescribed codeine as an analgesic after delivery. Postmortem examination of the stored breast milk sample showed morphine levels 4 times higher than expected. Upon genotyping, the mother was found to be heterozygous for a CYP2D6, that is cytochrome P450, 2D6, 2A allele, and a 2 gene duplication was there. Thus, the mother had 3 functional alleles and was classified as an ultra-rapid metabolizer. The extra enzyme resulted in increased orthodemyelination of the codeine to morphine, and consequently very high concentration of morphine were found in both the breast milk and in the blood from the child. So this was one of the cases which we can correlate which what may have happened, the attempt to kill Lord Krishna by a poison damsel, that is the Vish Kanya, by breastfeeding containing opioids. So this was a biological war weapon which was used. Then in Romeo and Juliet, it was opium. Again, it was one of the causing. Then the Amul, which we correlate, it does not contain any opium, but it is mal rahit. Amal. The word comes amal. It is basically the amal was in Rajput where it was famous because they used to eat opium while going to war. So it was a defense for preventing the pain of injuries. They used to consume it, and that it used to cause euphoria in them, and they used to fight vigorously. And that is how they used to say Amal Khaya, Amal Liya as a routine, as a ritual in them. Then the aconite we have discussed, the arrow, it has the shape of like a cone. So Mitha Vish, it was used by Duryodhan to kill Bhim, but somehow he survived. The cardiotoxicity which occurs, it is the cone shaped arrow poison. You can see the shape of the root, and it is just like a cone of our ice cream, and it is like an arrow. So easy recall, pehchan con, because everything is con. So there are constriction of people, conversion of the brain, conduction block in the heart. Management is control the fats, control the EV blocks, consider atropine for managing the bradycardia, and convert the toxic alkaloids into non-toxic metabolites by boiling under, by decomposition or maceration. So it will be decomposed. It will not be found in postmortem. Then the terrorism which is caused by Jamal Gota. You must have heard about Charles Shobraj. He was a famous serial killer. He used to be a serial killer, a tourist guide, and he used to attack and that has caused many casualties. And that was used was Jamal Ghota. It was to first to cause the loose motions in the victims, and then as a good Smartian, he used to offer them ORS packets and medication, and that used to contain the Mandrax, that is the methaqualone, which was pretended to be an anti-dysentery medicine, which used to knock them down, stupefy them, and sometimes people died. So he was a famous serial bikini killer, and that was a terror which occurred in the 1990s by Charles Shobraj, and the Supreme Court judgment has documented all these things. So you can refer to it and you can understand how a biological product can be used as a terrorist weapon to cause terrorism to so many people by killing them. Then the ricin, that is the five-letter word. It is the palm of Christ. You can see the leaf is just like a palm, which is having five leaves. So it is a palm of Christ. It was considered the palm to use to touch anyone used to get healed. So it is Midas touch because it is containing many medicinal properties. And one of the medicinal properties is having ricin, which is actually a toxin, and that used to kill people. But water to him, and he becomes relieved of cannabis hyperemesis, and he offers whatever you want. That is the boon people ask for, and that is what is correlated with our mythology. That is the cannabis. Then there was actually cases of Bhola Munakka chocolates. It was a brand of chocolate sold in Bombay near schools. It was used to cause intense craving among children. It was they started selling for 5 paisa and they increased the cost to 5 rupees and then to 50 rupees. And the parents were worried that why the children in the recess are buying so many chocolates, and they found that it contained cannabis and opium, which was under NDPS Act. The seller was arrested and they were punished. So this was a recent case in Bombay which happened, and they were named as Bhola Mulaka because it means to use on Bhola children, that is, and to make them more imbecile. Then the zombie making of voodoo magic. Now in this Dhatura plant was as a nice extract was offered that used to cause the stupefying effect, and cannabis along with that they used to fed to stupefy the victims, and they become maniac, behaving abnormally like going mad, and then they were tamed by hitting leather belt to control the vendors. So that is what we also see in our villages. People are getting maniac. लोग बरगद के पेड़ के नीचे जाते हैं और वहां पे they suddenly they start behaving abnormally. So what they are consuming, they are actually consuming the similar looking seeds. You can see this, these are the seeds of datura, and they are the seeds of the chili. So they are, look so similar, so they get confused and sometimes they eat it and they become behaving mad. And that is what we say, the drug induced madness, that the Zatura intoxication which causes the mania or the delirium, which is caused by the intoxication of Datura toxin. And people start behaving abnormally, and people suspect that this is the impact of the बरगद का पेड़, कोई जादू टोना हो गया, कोई भूत प्रेत का साया आ गया इस पे, and they used to get beaten by the the कहते हैं people who are quacks to heal them. But in zombie making, when they used to beat them, then they used to apply the tetrodotoxin, which was derived from fugu, as a zombie powder, and this was applied on the abraded skin to paralyze the maddened victim. So they were kept in the coffins alive, locked in for months, like the zombie. And that is what the voodoo magic was became popular, that people used to get victimized, and the terror which occurred especially in South America, it is still, it is the terror has been felt, that the zombie making is still going on and people in villages do practice this, and it is illegal though. Now it is punishable as a murder. If you are making any person zombie by this method, then it is equivalent to murdering the victim. The crime is equivalent to murder, and they are punished for imprisonment for life. So that is the basic principle, is the bioterrorist weapon which is used are the dhatura extract and the cannabis along with the tetrodotoxin for the zombie powder, and that causes the voodoo magic. So these are the nightshade family, the Datura. You can see the seeds you can identify of the Datura plant. This is the Datura flowers, bell-like belladonna, and you can see the Atropa nightshade flowers. And this is the belladonna plaster we apply locally for pain relief. And the apple, which is pineapple, which is we see as a spiny fruit of the Datura plant. And this is the tetrodotoxin, which is generated from the fugu fish. The powder is applied. If it is ingested, it causes neuroparalysis. And if it is applied locally, it causes paralysis in the limbs. Not, and the person remains conscious for the full time. So he remains conscious, behaving abnormally like a maniac. So they are think to be just like witches. They are behaving like a witch, and they are tamed and they are kept locked as a zombie. Then there was mushroom toxicity which occurred to Lord Buddha. It is related to the red mushroom. So we used to play the Mario and it gives the red mushroom, but it is toxic. So you should understand that toxic red color related to liver. It can be hepatotoxic and it can be used as a bioterroristic weapon. So you should not consume it. Neither you should let others. Then there is the jack-o'-lantern, which was quite common in the Halloween. We see the carved pumpkin. So similar to that, there is jack-o'-lantern. Mushroom is there. So you can see this. This is poisonous, and it is causing toxicity by the toxin which contains causing loose motions, vomiting, cramps, and diarrhea. And it glows in the dark. It is bioluminescent. So you can identify it. The stool will become bioluminescent. They are fluorescent. So that is an easy method to identify. And then coming to the last, that is the corona. We have known that corona, we thought that corona is itself a bioterrorism, but along with that, the bioterrorism occurred was of the corona's cure, that is the herbal tea. So do you know that it contains tussilago plant, which the word tussilago, it is derived from tussiv, that is cough. So it is a decoction which was used to relieve the cough, but both are thrombogenic and both combined has increased the incidence of fatal pulmonary embolism in the victims. So it is, although it is not an intentional act, but people are promoting, many people who are quacks or even some doctors are saying that you should take herbal tea as a decoction. But herbal tea contains a toxin which is thrombogenic, similar to what the corona is causing. Corona is itself thrombogenic, so it is causing pulmonary embolism. Most of the deaths which are occurring due to COVID illness are due to pulmonary embolism, and it is aggravating. The Tussilago herbal tea has aggravated this, and it has given a pseudo benefit of relieving the cough. But cough relieving is not the cure for any illness which is related to the flu. It has to be, the cure has to come by getting the antibody buildup, that is by getting the plasma therapy which supports to fight out the infection. So we have to understand that we should realize that relying on a general information of using herbal tea in any flu will benefit has actually harmed in this epidemic, and it has created the pandemic situation in which we also have become the culprit as promoting by giving some therapies which are not evidence based, and they have actually caused the fatality. So this is the basic learning. So in the last, I will say that everything is fair in love and warfare. So we know that bioterrorist activity is done, and they believe, the people who are terrorizing with bioweapons, they think that everything is fair. Either in warfare, you can do anything, but it is unethical, it is wrong. And as a doctor, as a man of science, we should understand that we should not use this knowledge of our knowing about the toxicology or knowing about the uh, infectious agents and microbiology. We should not use this to harm others. That is the basic message I would like to give. Hope you are able to understand. Any questions, any queries? I would like to thank the KMC team for listening to me patiently. Now take over to Dr. Pratik Rastogi, sir.
Thank you, Dr. Vivekanshu, for a very informative talk. There are two questions which have been put up by our students. The
Okay, sir.
first one is, what's your take on allegation that coronavirus is a bioterrorism agent?
Sir, it is very rightly right now we can say that it can be used as a bioterrorist weapon because it has all the features of this because it is rapidly transmitting, it is causing infection at the pandemic rate, and there is no cure till now. There is no vaccine. So any agent which is not having a cure, which is like just like smallpox, we have a vaccine for that, but now no one is vaccinated. So even a smallpox virus is released, then it can be an act of bioterrorism. But till now, since we don't have any proof of who has released the coronavirus in the environment, it is expected that it is an inadvertent release by the lab which was doing some studies for making the vaccine or doing the research, and they have transmitted it. So till now, the information which is shared by WHO is that it is an inadvertent act of, and it is the negligence of the lab which were handling the virus, and that has caused the release into the first the people who are working in the lab and to then to the society, and now it is spreading from one country to another, and now it has become pandemic. Any other questions, sir?
Second question is,
Yes,
how
sir.
are bioterrorism and biological warfare different?
Now, bioterrorism is what we are saying that biological warfare is caused by the countries. That is, the leaders of the country, like a dictator is there, and they are planning to harm another country's people. Then they are planning a warfare, like it had happened in World War One, World War Two. So that is a warfare. And terrorist activity is by a cult, by a group of people who are trying to terrorize, like Osama bin Laden. He tried to terrorize people by using weapons. So he became a terrorist. So that is a bioterrorism if they are using biological weapons. And biological warfare is if it is done by a country to kill people of another country to win over. That is what it is. Still, it is unethical and that is illegal. Terrorist activity is illegal and biological warfare is unethical as per the convention which has been taken by the UN. Hope I am able to make you understand.
Yeah, Dr. Vivekanshu, there is one more query.
Yes,
Could
sir.
you please explain in brief voodoo making? So I think they are interested in voodoo. So
Okay. So
just
voodoo
want you to
magic,
explain it.
yeah, voodoo magic is basically आपने देखा होगा if I make you understand in simple Hindi, you must have seen the dolls, people keeping the dolls in their puja and then piercing the dolls with the needles and actually trying to aim the victims who are their enemies to cause them illness, to cause them sickness. So it is not just localized to South America, but since it is practiced there since past, so that has been known as the voodoo magic because what they are doing in voodoo magic is they are making zombie. Zombie making is basically making first the person maniac. That is, he start behaving abnormally, and then they are tied up by the people who are planning to harm further. So it is mostly the either the family members or their rivals. They tie the victim and then they administer. They try to cause injury by abrasions over the skin by stroking with a hunter or a belt, leather belt, and that causes the local abrasions over the skin. And then they apply the tetrodotoxin, which is the fugu derived toxin, along with many other chemicals which are undisclosed. But what they have found on chemical analysis, one common occurrence was tetrodotoxin, which causes paralysis in the victim. So the victim lies straight down on bed. The voodoo victim of voodoo magic, the zombie, will behave like he's in a conscious state, lying on in their captain coffin, and then they are placed either in the jungles or sometimes outside their houses in those live coffins. And although they are given food time to time by their perpetrators, but ultimately their what we can say, their life is totally disturbed, and they are tamed as a what we can say, the as a laborer or as a servant to them. So this is the way of overcoming others. When you can't overcome them with your affection, then people try to do voodoo magic to by zombie making to overcome the people they want to stay with them. So this is considered illegal, but if you read on the internet, a lot of information is available. But what scientific knowledge we were able to trace by the journals, by the articles written on the scientific basis, was that it is used to terrorize people by using biological weapons, which are the dhatura, commonly available. It is a weed plant which is available, then the cannabis extract, and the zombie powder of tetrodotoxin, which is applied locally. Because if it is given orally, then the person will die. Tetrodotoxin is so toxic when it is ingested. But if the person is applied locally, then it just causes neuropathy and the person remains conscious. So he remains in a state of suspended animation, not dying, but not able to do his routine activities independently. So he becomes a dependent victim, like a tamed animal.
Thank you, Dr. Vivekanshu, for that explanation. Is there any other query by any other student? So, if there is no query, I'll request Alfred sir to kindly give his comments.
I'm here. I've been listening patiently. Thank you very much. That was a good talk,
Yes, sir.
and I'm sure you'll have more such talks for us.
Sure,
Yes, sir,
sir.
definitely.
So, uh, thank you, Dr. Vivekanshu, for a wonderful interactive session, and we hope to listen to you again in future sometimes.
Definitely,
So,
sir. It would be my
yeah,
pleasure. I feel highly obliged that Kasturba Medical College has considered us to share the knowledge and discuss a very relevant topic, because bioterrorism is one of the burning topic which is in everyone's mind right now, and especially the medical students. So hope I was able to generate the awareness.
yes. So, thank you, Dr. Vivekanshu.
Welcome, sir.
Yeah, we'll close down this discussion now.
Okay,
Thank
sir.
you, one and all. Yeah,
Okay, sir. Goodbye.
goodbye.
Thank you.